Hello, my name is Alexandra Kavanagh, and this is my second video for HNN313 Perioperative Nursing. The purpose of this video is to explain the role of the perioperative nurse in the operating room in regards to the surgical count process. The perioperative nurse, also known as the circulating nurse, is responsible for coordinating all activities within that operating room, including maintaining patient privacy and safety, reporting relevant information, ensuring sterility of surgical team, and the all-important surgical count. The surgical count is the process of counting any item that may, however remote, be retained in a patient during a surgical procedure. Greenberg et al. State that despite near-universal implementation of manual counting protocols for surgical instruments and sponges, incidence of retained objects in surgical patients persists. The Australian College of Operating Room Nurses stated in 2011 that the surgical count process must be performed by 2 nurses, one of which is usually the Division 1 circulating nurse. The count involves ensuring all instruments, gauze, needles, blades, and the like are not left within the open cavity of a patient. This count takes place at several times. The first is a baseline count that occurs when setting up and opening sterile items. The second is the first closing count when the surgeon has completed the majority of the surgery and begins to close the wound. The third is the second closing count. This, for example, would occur when a woman has a cesarean section and after the womb is closed but the abdomen is still open. The fourth and final count happens upon the closure of the skin. Other reasons that a surgical count would take place is if there's a change of staff, if you're adding items to the sterile field, or if there's a discrepancy. Riley et al. Stated in 2007 that it is commonly recognised that poor communication practices influence surgical outcomes. If there is a discrepancy, it is the job of the circulating nurse and the rest of the surgical team to ensure everyone is aware. There is a recount as per hospital guidelines, to do a thorough search of the operating room, including bins, linens, drapes, and buckets, and as a last resort, call X-ray and document incorrect count. They then proceed to fill out incident forms and notify the nurse in charge. Throughout this video, I have briefly discussed the role of the perioperative nurse in the operating room and explained their role in the intraoperative surgical count process. Thank you for watching.